They'll be used primarily in a humanitarian role. They will assist us in food bank operations, transportation, and any other mission so designated. But they will only arrive here in Southern California in our operating area if I request them through the state's Office of Emergency Services. And again, they are here to help us all, and the whole idea is to save lives. Now, this is a storm, unlike any we've ever seen, but it's still a storm, with a beginning and an end when the sun will come out. Thank you all, and we will see you beginning tomorrow at our daily press briefings at the Emergency Operations Bureau, which is located in East Los Angeles. We'll post the time on our social media, and thank you, and please, #SaferAtHome. I will now introduce back Supervisor Catherine Barger from the 5th District.
Thank you, Sheriff Villanueva. As I mentioned, we are here today to share more about the allocation of the test that we are about to deploy immediately throughout Los Angeles County. Last night, Mayor Eric Garcetti mentioned launching test kits in the city of Los Angeles. Those are in addition to what we are announcing today. For the first days of testing, our initial delivery of kits will help us prioritize first responders and medical personnel. I would like to thank Councilman David Rue, Chair of the Los Angeles City Council Committee on Health, for his partnership and diligence in getting these contracts and for helping us secure the initial 20,000 tests. I would also like to thank Los Angeles City President Nuri Martinez for her leadership and for her dedication of valuable resources. And of course, I want to thank Supervisor Hilda Solis, Chair Pro Tem of Los Angeles County Board of Supervisors, and the rest of my colleagues on the board, and our CEO, Sachi Hamai, who have all been strong allies in this effort, as we also have dedicated resources toward purchasing these kits. Our first responders and healthcare provider workers are on the front line of this crisis. We want to ensure the safety and must safeguard against any further transmission of this virus. In addition to the first responders and healthcare workers, we will continue to test high-risk individuals during our first phase. I also want to address our immediate efforts to test the public. Our public health lab has been running 3 shifts daily in order to test the first round of patients. They are continuing to work tirelessly toward this effort. Soon, the Department of Health Services will have the capacity to test 500 county patients each day. In addition, Los Angeles County has secured a public-private partnership with Curative in San Dimas. The 5th District Company is currently producing 1,000 test kits a day and is slated to increase that number. Our county CEO is in the process of securing contracts with CGen to further expand our supply of tests and our lab capacity. The county will continue to secure additional public-private partnerships with certified labs that either have excess capacity or can convert to COVID-19 testing. All of these efforts are remarkable progress to vastly expand our testing capacity. Combined, this ensures a sustainable supply chain of tests and other materials like gloves and swabs, which are needed to ramp up for the testing. Dr. Clayton Kazan, the county's representative leading our testing efforts, is going to speak momentarily about that. He is developing the inventory for all of the clinical and medical lab capabilities through our Department of Health Services and Public Health to maximize our capacity to test COVID-19. I'm reminded each day of how we are working together to keep our communities safe and healthy. These announcements open opportunities for us to scale up testing and ultimately to save lives. With the proper diagnosis, we can work to treat those patients who do test positive. I am grateful to the City of Los Angeles and Councilman David Rue for their partnership in this critical effort. With that, I would like to invite Councilmember David Rue up to say a few words. And again, it's about collaboration. This disease, this virus knows no boundaries, And it's important for us to capitalize and put together all our resources to ensure that the residents of Los Angeles County have the best now. With that, Councilmember Ryu.
Good afternoon. I want to thank Supervisor and Board Chair Catherine Barger, Council President Nuri Martinez, Dr. Clayton Kazan, the Coronavirus Testing Coordinator for LA County and Los Angeles County Fire Department Medical Director, and Dr. Barbara Ferrer, Director of the Department of Public Health, and all of the city and county leaders who have been working nonstop to respond to this coronavirus pandemic. I am here today to announce a positive step forward in the Los Angeles response to the coronavirus pandemic. My office and our city and county partners have been working round the clock to secure test kits to increase testing for the coronavirus. To combat this coronavirus, we must identify, isolate, and treat. And we know that nations that have gained the upper hand in this pandemic have prioritized testing. As of Friday, March 20th, 25,200 tests have been conducted in all of California, with only 2,400 tests completed in LA County. That is why Board Chair Barger, Supervisor Solis, Council President Martinez, and I, in addition to the testing already contracted by the city and the county, have secured 20,000 new tests for the coronavirus, with the ability to locally run and process 5,000 tests per day by this Friday. This agreement has been made with Seegene Technologies Incorporated, based in South Korea, with U.S. operations in San Francisco. They are approved for testing in South Korea and the European Union and are in process for U.S. FDA approval. Seegene is responsible for the majority of all coronavirus tests performed in South Korea. Their current global production capacity is 1 million tests per week, with a new production goal set to 2 million tests per week by mid-April. More importantly, as we ramp up this new production goal, Seegene has committed to providing 100,000 tests per week for the Los Angeles area, with the test processing capacity to run 30,000 tests per day through their national network of laboratories that they have already begun building. Seegene tests are currently being used in over 40 countries worldwide, including Italy, Germany, France, Spain, UK, Australia, and Israel. And we have the president of Seegene Technologies U.S. operations here today to answer any specific questions. Every minute counts, and in order to deploy these tests immediately, our offices have been working together to cut through the red tape. And combined $1.25 million of our own discretionary funds to buy these 20,000 tests and get them out as quickly as possible. These tests will be free to the public. And the first round of these newly acquired tests, as mentioned by Supervisor Barger, will prioritize healthcare workers and first responders on the front lines of this crisis. Dr. Clayton Kazan will speak more on that rollout shortly. But of equal importance and concurrent to this rollout, we will be working to both identify and contract with additional test kit manufacturers to secure more tests and laboratories, both public and private, to secure greater lab capacity. But as we have seen, this pandemic has created temporary global bottlenecks and shortages. We need more than just lab capacity and tests. We need to secure the critical materials that makes testing possible: swabs, gloves, trays, and more. Which is why the City and County of Los Angeles will be working together to address critical shortages and to source and acquire the materials we need locally. Council President Martinez will speak more on that. Now, please bear in mind, with increased testing will most likely come with an increase in the number of reported infections. As epidemiologists and public health officials alike will tell you, this does not necessarily mean we are having an outbreak of new infections. Rather, testing is helping us identify our current problem so that our public health officials can better isolate and treat the problem. We cannot beat a pandemic we cannot see, and we cannot properly address this crisis until we better understand it. The United States has fallen behind other nations in response to this pandemic, and we can't wait on the federal government to fix it. We need to take action ourselves. Los Angeles is not going to wait around. Los Angeles is working with manufacturers around the globe. Los Angeles is expanding our lab capacity and addressing material shortages. Los Angeles is working day and night to ramp up testing for coronavirus to the scale it requires. Let me be clear. This is just the beginning. And there's a lot of work left to be done, and everyone needs to be involved, from government to academia to private industry, to meet this crisis head on. Only then can we get the critical information that we need to meet this crisis head on, as Angelenos do, with courage, with hope, and with partnership across our city and across the globe. To speak a little bit more about the next steps, I'd like to invite up my colleague of the Los Angeles City Council, Council President Nuri Martinez.
Thank you. I'm very proud to see the Los Angeles City and the county partners work hand in hand to secure the agreements to increase Los Angeles capacity to test for the coronavirus. I want to thank Assistant President Pro Tem David Rue for his efforts, and Supervisor Barger and Solis for working so hard and for being here today. These are extremely challenging times, but the city and the county of Los Angeles must meet that challenge head on today, and this is why we're here today. But testing at scale takes more than just kits and labs capacity. Each test requires swabs, testing trays, and other materials. And of course, there is also a need for gloves, masks, and critical supplies for our healthcare workers. Cities and counties across the globe are facing shortages of these critical materials. Los Angeles is working nonstop to overcome these shortages, but we cannot do this alone. And this is why today we are calling on all factories and manufacturers in Southern California who have the ability to convert their production lines to do it as soon as possible. We need all hands on deck to properly address this crisis with the speed and scale that it requires. That means cooperation between government and communities and private industry. Southern California is in the industrial manufacturing powerhouse. And this crisis, unlike any other that we've seen in generations, we need everyone to help us. We are urging production lines to start making the critical materials we are desperately need to increase testing for the coronavirus. We should not wait for the president to use his Defense Production Act. We are Los Angeles. LA County alone has the 26th largest economy in the world, and Southern California is the largest contributor of the nation's GDP. I know we can do this, and we have to do this by working together. This is the only way that we can avoid the bottleneck of the necessary supplies that we need. Los Angeles will work with any company that has the ability to supply us during this critical time. We must work together to meet these challenges. So if any manufacturing firm or industry is listening, please work with us to address this crisis. And the Los Angeles City Council, the legislative body of the City of Los Angeles, will continue to work with the LA County Board of Supervisors and their legislative branch of the county to be able to assist Angelenos, first responders, and residents alike. Thank you so much. I'd like to introduce County Fire Chief Osby.
Thank you, and good afternoon. Darrell Osby, Fire Chief of the Los Angeles County Fire Department. On behalf of the Los Angeles County Fire Department, I would like to thank our Chair of the Board of Supervisors, Captain Barger, our Chair Pro Tem, Hilda Solis, the entire Board of Supervisors. In addition to that, I would like to personally thank my department head peers that I've been working with collaboratively, particularly Dr. Barbara Ferrer from the Department of Public Health, who we've been working together to try to take preventative measures to flatten the curve to reduce the impact of COVID-19. I'm here today as the fire chief of the Los Angeles County Fire Department to reassure our citizens as it pertains to our mission, our firefighters, our paramedics, our lifeguards, that we are still here 24/7 to protect your needs as it pertains to emergency medical services calls, structure fires, hazardous material incidents, along with other incidents that are dispatched by 911. I will say that in my department, we've made determinations in relation to critical employees, and our non-critical employees are being trained to do other functions in the department and the county. But I will say that I'm extremely proud in relation to our employees, because during these critical times of need, as we monitor our attendance records, that there's been no challenges in relation to people coming to work, executing the mission of the Los Angeles County Fire Department. I'd also like to thank our CEO and our other labor partners and collaborators as it pertains that we're doing all that we can collectively and collaboratively to ensure the business operations of the department. In addition to this, we've had procedures in place prior to the COVID incident, but we're enhancing those procedures in conjunction with the Department of Public Health, the Department of Health Services, and CDC to ensure the utmost safety of our department personnel. In addition to this, when our personnel arrive to work each and every day, there's being screened daily at lineup to ensure that they're not coming to work ill, to protect our workforce, because our workforce is the most vital aspect of our mission. In addition, to ensure that when we do go on calls, that we're not impacting our victims and our constituents that called 911. Our firefighters, our firefighter paramedics, and lifeguards have been given additional direction in relation to deconning themselves after each incident, ensuring that they clean their supplies and their medical gear in between each calls to ensure that we're not passing that along to other victims or patients. In addition to that, we've been working with the county, the state, the federal government, and our vendors as it pertains to ensuring that our firefighters and paramedics have the critical gear that they need, such as gloves, masks, gowns, and goggles to ensure their safety. For some of our employees that are not assigned to the front line, they're also assigned to the county EOC that was mentioned earlier by Sheriff Villanueva. And also we have incident management teams throughout the county assisting in such things as logistics and other aspects to ensure that we're assisting the county in this endeavor. I wanted to speak personally about some of the things that we've done internally within the department to enhance our service to our community. One of the things that we've implemented is a newly implemented telemedicine program designed to help mildly impact the citizens. What that means is that our firefighter paramedics in the field are able to do video conferencing with nurse practitioners and, as applicable, with ER doctors to try to get a better assessment of patients in the field. What that means is that, to the extent possible, we are not transporting patients unnecessarily to emergency rooms. However, I would like to announce that we do monitor our 911 calls daily, in particular as it pertains to fever, cough, shortness of breath, vomiting, and diarrhea. We're giving our firefighter paramedics additional information. In addition to that, we're also giving them advanced notification to our first responders, including our law enforcement and ambulance providers, so they can be aware while providing care in advance of arriving on scene. Typically, our department receives about 1,400 incoming 911 calls a day. Typically, we go on about 1,100 responses a day. We've seen a slight uptick in relation to the number of calls. It's gone from 1,400 to 1,500 911 calls that we receive each day in our dispatch center, and our incidents have slightly risen from 1,100 calls on average a day to 1,200 calls a day. As a fire chief, I am grateful to hear that the county, along with the city and other stakeholders, are doing all that they can to increase the testing for COVID-19. Our medical director will come after me to discuss that in more detail and in depth. Final thing I would like to say is that I've also been collaborating with our local, state, and federal partners as it pertains to mutual aid requests if needed. We have to take into consideration that we're still an all-risk organization, and we need to be prepared for any other type of incident that may happen, like an earthquake or any other type of major incident. I would also like to really thank some of our local restaurants, particularly those that donated food to our fire stations. As you can imagine, we have firefighters and firefighter paramedics and lifeguards that are working multiple days in a row at work. They're unable to go home. It's been tough at times to get food to eat each and every day. So I'm grateful for the restaurant owners that provided food for our fire stations and for those restaurants that are still open in relation to supporting our first responders. For our citizens, the only non-emergency business aspect of our department that's still functioning is our Fire Prevention Bureau, only for new construction. We have some major projects still occurring in the County of Los Angeles, and we will work with you in relation to those types of projects to ensure that they're completed only for new construction. I would like to once again just re-emphasize to our citizens that are watching to adhere to our directives as it pertains to our public health director, CDC, and any other guidance to ensure that we're following that guidance to lessen the impact of COVID-19 and to lessen the impact as it pertains to the particular 911 calls that my department needs to respond on. In closing, I would like to thank all of our citizens and all of the concerned people that have emailed us, written letters, passed along their prayers and thoughts to our first responders that were exposed. Due to privacy issues and HIPAA issues, I will not get into the number of firefighters that have been impacted by this COVID-19, but we do have members that are at home that we are monitoring, and I can say that we talk to them several times a day, and they're all doing well. Next, I would like to bring to the podium Dr. Clayton Gazan, the Medical Director of the Los Angeles County Fire Department.
Good afternoon, and thank you. I'm Dr. Kazan. I'm an emergency physician, and I am the medical director for the Los Angeles County Fire Department. I'm responsible for overseeing the health and safety of our first responders who are working every day to meet this coronavirus pandemic and keep people safe in Los Angeles County. As stated earlier, the first phase of our new test kits, graciously funded by Supervisor Barger, Supervisor Solis, Council President Martinez, and Councilmember Ryu, will be rolling out to first responders and healthcare workers on the front lines of the pandemic. These paramedics, medical staff, firefighters, and other essential personnel are heroes in this crisis. They are selflessly putting themselves on the line every day to fulfill the mission of public safety. We owe it to them to do everything we can to ensure their safety as well as that of their family members. The rollout of this first phase of new testing will begin this week, and it will take about 1 to 2 weeks to complete. And I want to go through very quickly the phased rollout approach that we're taking. Phase 0, as we call it, is establishing contracts and determining what lab capacity looks like across Los Angeles County. We have been actively engaged in that process, as you will hear more of within this news conference. Phase 1 will be ensuring access to first responders and healthcare providers. Phase 2 will be ensuring access for vulnerable patient populations, such as homeless shelters, skilled nursing facilities, group homes, and other vulnerable populations. Phase 3 is ensuring that doctors who are taking care of patients that are at home have access to be able to get the testing that they need for their patients. Because the goal is that we want to keep patients that don't require hospital services away from the hospitals to maintain hospital capacity. And then phase 4 is ensuring widespread public access to testing. We're working in these phases not specifically in line, but we are taking them as priority 1 through 4. We are also assisting other people in this healthcare space that are already working more with their physicians to ensure that they have the infrastructure that they need so they can get their patients tested. During this time, we're working diligently to secure more tests from manufacturers and more capacity from the labs that process our specimens. We'll continue monitoring the innovation in the market, and we'll pivot as needed as new testing processes come available. We're addressing critical shortages of personal protective equipment as well, both for the administering of this test and for our healthcare providers in the EMS world and in the hospital world. By the end of this phase of 20,000 tests, we plan to have many more lined up and ready to go to expand our testing further. Again, prioritizing high-risk populations like seniors, people experiencing homelessness, and those with underlying significant health conditions. We want doctors to be able to order testing and get timely results to help manage their patients so they can avoid needing the hospital. And ultimately, we want to reach the scale that the general public can access tests as well. I'll be working with the city and the county to reach the next phases of testing rollout, increasing testing and lab capacity as quickly as possible. We will also be doing everything we can to support the efforts of partners like Kaiser, Providence, and others to scale their operations. As stated earlier, we need everyone's help and cooperation on this. We urge everyone to stay at home and have patience. These are tough times, but we're ramping up testing, and I assure you that we're all working every day to keep everyone safe. With that, I'd like to invite up Dr. Barbara Ferrer, Director of our Department of Public Health.
Thank you very much, Dr. Kazan, and I want to also thank all of our leaders who are here today and working across the county in collaboration and cooperation to make sure we're slowing the spread. I particularly want to thank Supervisor Barger and all the other board supervisors who have really been leading the county's efforts to remain coordinated and effective in our response. Today we're reporting 128 new cases, and I'm really sad to report an additional 2 deaths. This brings the total number of deaths to 7 in LA County. To the families and friends who lost loved ones, please know our thoughts and prayers are with you, and our Los Angeles County community very much feels your loss and your heartache. The total number of cases now in LA County is 536. And this includes 17 cases that are reported by our partners in the city of Long Beach and 3 cases that are reported by the city of Pasadena. I want to note that 80% of the cases are happening for are people who are between the ages of 18 and 65. Fully 42% of the cases were happening in people between the ages of 18 and 40. This virus can, in fact, infect people across the board. And all people need to be vigilant and practice every directive that's being issued at the state, county, and local level. 90 cases have at some point been hospitalized. That means about 17% of people who are diagnosed as positive with COVID-19 end up needing some hospital care at some point during their illness. All confirmed cases are being isolated and close contacts are quarantined. As of March 22nd, about 4,700 people were tested in LA County, and about 10% of people who are tested are testing positive. And I know, and as you heard from Dr. Kazan, there is still a lot of frustration, and I'm thrilled that we have Dr. Kazan's leadership. He's dramatically increasing the ability of people to access testing, particularly those people for whom testing is absolutely essential in order to make sure they have access to the treatment options that they need to recover. Nonetheless, since we're going to experience some limitations in testing for the next few weeks, it's more important than ever for every single person to follow all of the social distancing requirements. And I want to thank everybody who's been extraordinarily diligent. And I also want to acknowledge how devastating these requirements have been to some of our households, and appreciate everyone's willingness to do their part. But I want to remind the rest of you and the rest of us who are not following social distancing requirements that it's inappropriate for people to congregate at parks, beaches, piers, or on the trails. You cannot be in spaces and places where you are not able to socially distance, and that means you need to keep apart from each other at least by 6 feet. We need your help. Social distancing isn't a sometimes I do and sometimes I don't. For this to be successful, we all need to practice social distancing all of the time, particularly when we're in any public spaces. There's one other tool that we use and we count on for slowing the spread, and that's our ability to ask people to isolate and quarantine themselves if they're either a positive case or they've been in close contact with a positive case. And it's really important that people adhere to the guidance around isolation and quarantine. Isolation is required for anyone who's positive for COVID-19 or whose clinician has told them that they're likely to be positive for COVID-19. In this time where everyone cannot get tested yet, if a physician has told you that you are likely to be positive for COVID-19, you too must isolate yourself. And this is what that means. You need to stay home for at least 7 days and until you're fever and symptom-free for 72 hours, whichever is longer. This means please do not leave your home unless you need to go for a medical appointment. You need to notify all your close contacts that you are positive for COVID-19 or likely positive for COVID-19. And close contacts means your intimate partners, caregivers, and people who live in your home, or people at work, if you're an essential worker, with whom you may have shared very close space. As much as possible, you need to stay away from other people in your home and use your own bedroom and bathroom wherever you can. Do not prepare or serve meals for people in your family. Do not share utensils or cups or food with others. If you're a caregiver, please try to find someone else in your family to perform daily activities that have you in close contact with others. If you need to see a doctor, please call before you go into a clinic or a hospital. And it's good for everyone to make a plan and for how you will be prepared should you need to isolate yourself. Others who are close contacts need to quarantine themselves. And quarantine lasts for 14 days. This is the incubation period for COVID-19. This means you need to stay removed from others for up to 14 days from the last exposure you had with a person who's positive. Close contacts, again, household members, intimate partners, caregivers, and those who spend significant face-to-face time, less than 6 feet apart, for extended periods of time. Quarantine also means you need to stay home. You need to stay away from everyone else. You must have essentials delivered to you in your home. Please take us seriously. If you are isolated or quarantined, you should not be going to the store to get your groceries or your medicines. You need to find others to help you do this. Now, I want to note that healthcare workers and first responders have their own guidance for isolating and quarantine, and that's slightly different from what I talked about. But everybody else, this is the guidance around isolating and quarantining yourself. I also want to talk about folks who don't talk to their provider because they have very mild illness, and they too want to know what they can do. If you have mild illness, please stay home. Same thing. Isolate yourself from others for at least 7 days and until you are fever-free and symptom-free for 72 hours. Even with mild illness, at this point in time when everyone cannot get tested, you need to assume you could be positive for COVID-19 and reduce the possibility that you will spread this disease and, frankly, any other disease to those in your household and those who are your close contacts. And for everybody else, when you're not sick, you're not isolated, and you're not quarantined, we ask you to stay home as much as possible. And on Saturday, our Safer at Home order was amended to be consistent with Governor Newsom's March 19th directive for all Californians to stay at home except to provide or access essential services. Our enhanced order prohibits all gatherings and events and clarifies that golf courses and personal grooming services, including hair and nail salons, are non-essential services that need to be closed. You can find our order and lots of other good guidance and information at our website, publichealth.lacounty.gov. I'm going to close with social distancing because I know there are so many questions about what this means. But it really means stay at home if you're not an essential worker, and when you're out to access essential services, you must keep 6 feet between you and everybody else. There are many people, and everyone saw the pictures all weekend, who are congregating on our trails and on the beaches. This is not appropriate, and we ask you, when you're out and about, wherever you are, to practice the maximum amount of social distancing possible, even in our outdoor spaces. In closing, we all need to operate with the assumption that there are COVID-19 positive people anywhere, and that we all have the potential to infect others or become infected. Now we're going to be ready to take your questions.
Jeff, we are now ready to take questions.
Okay, ladies and gentlemen, for those of you that are attending online, we're going to take your questions in 2 different sections. For those of you that are logged in and see the meeting, please raise your hand and I'll unmute you into the call. We'll pause 15 seconds. The first question comes from the line of Robert Garova. Robert, please announce your name, announce your media outlet, and proceed with your question.
Yeah, Robert Garova with KPCC. Governor Newsom said over the weekend that there was some community surveillance testing carried out in LA County. Can you provide any details on that? And then the second part of the question is, with the governor's talk of community surveillance seemingly pointing towards more broad testing, how does that compare to what LA County's current guidelines for testing are?
It's a great question, and we're waiting for the results from the Community Surveillance Project. There was a small community surveillance project here in the county, and as soon as those results are finalized, we'll report them out. And obviously, the surveillance projects are slightly different than the need for people to be tested when they are symptomatic. The surveillance project is collecting specimens in a slightly different way, so that it's not using the same tests that are being used to diagnose and then figure out the treatment plans. But we can get you additional information. Hopefully by tomorrow we'll have the Community Surveillance Project results, and we can share those with you. That really tells you how many people in a given population may in fact have already been infected with COVID-19.
Thank you. The next question comes from the line of Steve Gregory. Steve, please announce your name, media outlet, and your question.
Yes, thank you. Steve Gregory, KFI Radio. Thanks for taking my call. A couple things. First of all, Chief Osby had mentioned that the numbers of firefighters that might have been infected or self-quarantining is protected under HIPAA. That's not protected information. Numbers, you can tell us, and I think the public needs to know how many first responders might be infected through the county. Secondly, a lot's been made about the testing and about the availability of testing. There still seems to be some conflict as to who deserves to get a test, who shouldn't get a test, and are you still promoting that people need to wait for symptoms to surface before they get tested?
Chief Osby, would you like to answer the first part, and then I'll let Barbara answer the second part regarding the number of first responders that LA County is reporting.
Yeah, Darrell Osby, Fire Chief of the Los Angeles County Fire Department. And I was advised that as it pertains to the privacy of our first responders, our firefighters, firefighter paramedics and lifeguards, not to release numbers due to confidentiality and connectivity back to our department and potential HIPAA guidelines. Therefore, at this time, I will not release numbers. But what I will say is that we do have some firefighters that have been exposed. They're at home. They're resting comfortably. We're continuously monitoring them. In addition to that, we do have some firefighters that have been exposed and they're being isolated, and they're doing fine at this time.
And then, Dr. Kazan, if you want to answer the second part about how we're determining who's going to get tested.
Yes. So to answer that question about how we decide which of our first responders are going to be tested in this first wave, we are still developing these protocols right now. We are following the California Department of Public Health's recommendation that we do not test people that don't have symptoms, because there's very limited utility in a negative result for a person that is not yet exhibiting symptoms. We are still developing those protocols, but they're based on the symptoms that the first responders have. And then we will bring them in to a special appointment for testing with us that can be done in a mobile fashion in their vehicle without exposing any of our personnel.
Dr. Kazan, a quick follow-up. There's a lot of rumor, and we get a lot of calls in the newsroom constantly about people concerned about the aerosolization of the virus. And I mean, we're even getting reports that the virus stays active in fecal matter for 5 days, things like that. Can you address how concerned are people, how concerned should
Really important for everyone to understand that this virus is transmitted through respiratory droplets. They're pretty big in size. I know we can't see them, but relative to droplets, they're of a nice size, and they actually fall to the ground or to a surface. They don't remain in the air for any extended periods of time. It's not like measles, which in fact is what we call airborne. It's very different. This is respiratory droplets. So thanks for your question.
The next question. Claudia, I will go ahead and have to mute your line. The next question comes from Patrick Healy.
Thank you, Patrick Healy from NBC4 News. 2 questions, if I may. Number one, for Dr. Ferrer, with the additional testing kits we're receiving, at what point do we expect we will catch up and be able to get an accurate picture of how widespread the infection is in the community? And the second question would be for the sheriff, what is the threshold for summoning the National Guard to Southern California?
Thanks. We'll start with Dr. Pereira.
Thank you. A great question. Obviously, we're going to use some modeling. But we really look at the percent of folks who test positive. And so, obviously, we don't need to test everyone to figure out what that relative rate of positivity is in our community. But it would be nice in a community where 10 million people live to have that number be significantly higher than the 4,500 people who have been tested to date. As I've noted over the last weeks, we've sort of held steady at about 10% of people being tested are positive. And remember, there are restrictions on testing now that have us testing symptomatic people. That number could go lower. It also could go higher once there's more capacity. But we'd like to see a significant increase in the number of people who are tested to get at the issue of how widespread might the infection be. But I want to reassure everyone that we never will need to have everyone tested to figure that out. There's lots of good ways of us modeling based on more data points. And in this case, we'd need a 10 or 15,000 more tests to feel like with some confidence we could do some modeling that would be more predictive than the modeling we're doing now based on the smaller sample.
We're going to go ahead and move into the second part of our Q&A, where those of you that have dialed in,
There was another question. There's another question for Sheriff Villanueva.
I believe the question was regarding whether or not to use the National Guard and when we deploy them. This is going to be based on the request from our individuals on the ground, our law enforcement, our fire resources, our first responders on the ground, or other missions, for example, service supplies, food supplies, humanitarian issues. If the request comes from within our operating area, which is Los Angeles County, well, then I make that request to the state and I'll ask for the National Guard resources. If I don't ask for it and I don't get the request locally, we are not going to see them here in Los Angeles County.
Now we're ready for the next question, Jeff.
Yeah.
okay, thank you. So we're going to move into our second part of our Q&A. Many of you have dialed in. We're going to go ahead and we're going to unmute the phone lines one by one. And if we don't hear anything, we're going to go ahead and move on to the next line. We just ask that when your line is unmuted, to please announce your name, announce your media outlet, and proceed with your question. So here we go for the round robin. Hi, your line is unmuted.
Hello, this is David Rosenfeld with the LA Daily News.
Okay.
Hi, David, please proceed.
I have a question about we're following in Redondo Beach, the Kensington Senior Living Facility. It's especially concerning. I wonder if it's on your radars and if there's anything special that you're doing to keep abreast of that situation.
I'm going to let Dr. Pereira answer that question.
We have a number of outbreaks in some of our senior facilities that we're investigating right now. I'm trying to compile accurate information about the number of facilities and where exactly the investigations are happening. But yes, any institutional setting that reports one case to us, and all cases, remember, are reportable to us, we do send out a team to investigate in any institutional setting, particularly those where there's at-risk or vulnerable populations. And that team really helps make sure that we immediately take action. In general, when there's one or more cases in a high-risk institutional setting, many people in that setting are quarantined. Just for those of you who have loved ones in those settings, I want you to know that that means that there can be no visitors, and we know how hard that is, but this is a time to figure out how to connect electronically and digitally with those that you love, because once we quarantine any facility, it means that there will be no visitors allowed.
Okay, we're going to take our last question now.
Okay, your line is now open. Please proceed with your question. Please proceed with your question.
Why don't you try?
Supervisor.
You want to try another line, or is that it?
Sure. We'll do it one more. Your line is now open. Please proceed with your question.
Hi, this is Annabelle with ABC 7. My questions are the following. How many of the known cases are patients who are currently in the hospital? How many active or recovered cases are in LA County so far? And then regarding the 20,000 tests, do I understand correctly that first responders and healthcare workers will be tested first? Are you considering closing county beaches, trails, and parks?
Okay, so I'm going to let Dr. Ferrer answer the question regarding how many of those tested are in the hospital. Then we'll go to Dr. Kazan regarding the testing, but I'll answer on the parks and trails. We are closing in LA County. I know that the city has taken action to close down the parking. I know the sheriff has instructed Lost Hills in that area to also shut down parking at our beaches. We are closing trailheads in order to ensure public safety as it relates to those people. The trails were too crowded, so we are shutting down our trails as well. I know the Santa Monica Mountains Conservancy also shut down their trails. So I think it's safe to say that all trails are shut down. So I would encourage people to walk around their neighborhood respecting the 6-foot social distancing and enjoy the community around them, because the trails are going to be closed until determined. So with that, do you want to answer the question regarding hospitalization?
Thank you, Supervisor. Yes, so there 90 cases have been at some point hospitalized. That's about 17% of all positive cases, and we'll continue to report on that every day.
Can you, a quick follow-up to that, how many cases have already recovered and how many cases are currently patients in the hospital now?
I'd have to get back to you with the number on how many patients are currently in the hospital now. That's a harder number to get, but we're trying to figure out an easier way to track on this. And the same thing on people who have recovered, because the guidance has changed on that in terms of what clears people. So again, it's a much easier clearance process, but it also means that people don't need to get back in touch with the public health department in order to clear. So, but I can talk more with you offline and just give you more details on both of those. Okay.
Okay, and on the 20,000 tests, wanted to follow up on that.
Dr. Kazan's coming up right. Yeah, Dr. Kazan's coming up right now to answer that question.
So could you repeat the question just about the priority 1 first responders?
Correct. The priority of the test and how would the public reach out to the county? Is the guideline still the same? The provider orders the lab test.
So at this point, we're prioritizing healthcare workers and first responders because they are our most critical workforce during a pandemic. We are supporting other efforts as well in the early part of our work to make sure that they are supported. So in particular, the large healthcare organizations like Kaiser, Providence, and others, that we can help them to make sure that they have the infrastructure that they need. They are already working on testing their workforce, even testing some of our workforce, and they're starting to reach out to their high-risk patients. So we're going to do what we can to support them with the supplies and infrastructure that they need to keep their efforts running full speed as well.
Thank you.
Thank you. Now we are going to go into the Spanish remarks, and we're going to start with I was going to call you Supervisor Villanueva, Sheriff Villanueva, followed by Council President Nuri Martinez.
Buenas tardes a todos. Como el director de operaciones de emergencias para el Condado de Los Ángeles, como alguacil, tengo la responsabilidad de asegurar de que todas las decisiones, las comunicaciones y un plan que estamos desarrollando para combatir el virus de la corona está en pie y abarca a todos los departamentos del condado y todas las divisiones políticas dentro del condado, que son todas las ciudades del condado. Y durante ese proceso, primero quiero darle las gracias a todas las personas que están trabajando en las líneas de la frontera de este virus. Esos son los médicos, las enfermeras, todos los empleados de todos los servicios de salud a través de todo el condado, todos los bomberos, los policías, los alguaciles, los que están trabajando en las calles, tratando de que los que están afectados por el virus tienen acceso a los servicios médicos y los que no están afectados pero han sido contactados por el virus que están en cuarentena propia y todos están observando esa distancia social del mínimo de 6 pies. Y la orden que se dio quiere decir, no es una orden como de ley marcial, eso no existe. Lo que estamos haciendo es una orden exclusiva para que las personas permanezcan en su casa. Cuando están en sus casas están más seguros. La única razón que uno va a salir de la casa es por ir de compras para comida, la farmacia para medicamentos, para el hospital, al visitar al doctor. Y esas son las únicas instancias que podemos salir de la casa en este momento. También eso no quiere decir que no podemos ir a caminar, a pasear por bicicleta, correr, cualquier cosa que no envuelve estar junto a otras personas al aire libre no es problema. El problema existe cuando se juntan personas en un área muy confinado. Eso es el peligro y estamos tratando de evitar eso. Durante el tiempo que estamos planeando para esta epidemia, estamos haciendo muchas cosas y hay un centro de emergencias que abarca todo el condado de Los Ángeles. Y ese centro de emergencias ya está al nivel 1, que es el nivel de alerta más alto. Y todos los líderes del condado y todos los directores de los departamentos más impactados y más relevantes en esta epidemia están ubicados en ese centro de emergencia y están haciendo todas las decisiones, la planificación, las comunicaciones, todo se decide en ese lugar. Entonces, todo lo que usamos en este centro de emergencia se basa de un estándar nacional, que es el Sistema Nacional del Manejo de Emergencias. Y ese estándar nacional se lleva a cabo a través de la nación con FEMA, que es la Agencia Federal de las Emergencias, y todos los estados tienen su subgrupo que se basa en lo mismo. En el estado de California es la Oficina de Operaciones de Emergencia, o lo que llaman CAL-OES. Eso es para el estado. Nosotros, yo como director de emergencia del condado de Los Ángeles, soy responsable de la organización dentro del condado para esta emergencia. Y todos los recursos, todos los requisitos para personal, para equipo, para material, ya sea material médico como las máscaras, las caretas, todo el equipo de protección personal, todo eso, los requisitos se dirigen al Centro de Operaciones de Emergencia y nosotros lo podemos honrar en ese momento si tenemos los recursos. Y por ejemplo, hoy mismo, hace unos 10 minutos, dirigimos al centro de almacenamiento de equipo médico $250,000 de máscaras protectoras. Eso lo recibimos el Departamento de Alguacil la semana pasada y le dimos también más de 100,000 máscaras a la Policía de Los Ángeles y a otras comandancias locales de la Fuerza de Ley. Y entonces estamos dividiendo todo ese recurso entre los hospitales y los que están trabajando en la calle, los bomberos y los policías. Eso es nuestra obligación y podemos, gracias a Dios, ofrecer ese nivel de protección a todos los que están trabajando para esta causa. Entonces, ese sistema de operación, de planificar, es muy flexible y permite expandir o hacer más pequeño el sistema según sea el tamaño de la emergencia. Esta es la emergencia más grande que hemos visto en toda nuestra vida y requiere que todos trabajen en coordinación, en cooperación, todos los diferentes departamentos. Y esto es una estación, esto es un estándar de una estructura organizacional que permite una comandancia unificada. Y en esta comandancia unificada están los elementos de salud pública, están los elementos de la orden, están los elementos de los bomberos, los que primeros responden a la calle, también están los elementos de de almacenes de comida, de todo lo que se necesita mantener la comunidad alimentada y seguros. Ahora, en este centro de operaciones también están ubicados todos los oficiales que son de información pública, lo que llaman en inglés PIOs. Ellos también están ubicados ahí y el mensaje origina en este centro después que las decisiones se han tomado y hay información que podemos pasar al público, se va a pasar por ahí. Esto va a ser, a partir de hoy vamos a trasladar a ese centro de operaciones para el pasar de información al público. En cuanto a la cuestión de la presencia de la Guardia Nacional, ellos ya han sido activados por ley del presidente y del gobernador, pero no lo hemos usado en el condado de Los Ángeles porque no se ha necesitado. Su presencia, si lo usamos, va a ser de una razón humanitaria, por mantener las líneas de comida, por ejemplo, de las utilidades, pero no se va a usar para la orden, no es ley marcial, y ellos son miembros de nuestras comunidades. Yo mismo fui miembro de la Guardia Nacional en mi juventud. Y encerrando, quiero dejarle a todos saber que esta es una tormenta, pero es una tormenta que nunca hemos visto en nuestras vidas. Pero como es tormenta, como cualquier tormenta, tiene un comienzo y tiene un fin. Y después, cuando se acabe la tormenta, vamos a volver a la vida normal. Y quiero darle gracias a todos los que están ayudando, están cooperando entre sus casas, entre sus comunidades, sus vecindarios, los que están trabajando día tras día entre la salud pública, los agentes de orden, los bomberos, todos. Y tenemos que trabajar juntos, honrar esa distancia social y juntos vamos a vencer. Gracias. Ahora quiero introducir a Nuri Martínez, que es la presidenta de la Asamblea Municipal de la Ciudad de Los Ángeles.
Gracias, Sheriff Villanueva. Buenas tardes, soy la presidenta del Concilio, Nuri Martínez, y quería agradecerle a la participación del Condado de Los Ángeles, a la supervisora Barger y a la supervisora Solís para trabajar con nosotros, y el asistente del presidente David Rue por todo lo que han hecho hoy para tratar de tener más pruebas y exámenes para las personas que están trabajando a combatir el virus de coronavirus. Lo que quiero decir es al público: cualquier compañía que tenga la habilidad de convertir sus líneas de producción para ayudarnos con tonetes y charolas y guantes y máscaras protectivas, si su compañía puede empezar a tratar de hacer este tipo de materiales, será muy beneficiante para nosotros porque tenemos una crisis en nuestras manos y no tenemos los suficientes materiales para poder conducir los exámenes que se necesitan para las personas como los bomberos, las enfermeras, los doctores que están tratando a las personas que tienen este virus. Le estoy pidiendo a cualquier compañía en la ciudad de Los Ángeles o en el condado de Los Ángeles, si usted tiene la habilidad de convertir su compañía para ayudarnos a manufacturar este tipo de contonetes, charolas y cualquier material que se necesita para poder seguir examinando a las personas, se los agradeceremos. Y también quisiera decirle al público que por favor ayúdenos a combatir este virus para quedarse en su casa. No les podemos suplicar más. Lo que tenemos es una crisis de salud en nuestras manos y lo que usted puede hacer es ayudarnos con quedarse en su casa lo más mucho que pueda y luego tener que decidir cuáles son las personas que van a tener este examen disponibles. Vamos a empezar con los bomberos y con las personas que están todos los días trabajando para combatir este tipo de virus que se riegue mucho más. Y esperamos que el público nos ayude, por favor, a mantenerse en sus casas. Sabemos que la crisis económica que nos va a llegar es muy importante y tenemos también que hacer todo lo posible para ayudar a nuestras familias. a recuperarse después de que pasemos por esta etapa y por esta crisis. Por eso les pedimos al público que por favor nos ayuden con mantenerse en sus casas. Muchísimas gracias. Quisiera ahora introducir a la doctora Ferrer con el Condado de Los Ángeles.
Muchas gracias y buenas tardes a todos. Quiero agradecer a todos nuestros líderes hoy por estar aquí y en todo el condado, trabajando juntos para parar este virus en las comunidades en el condado. Estamos bien tristes hoy de informar que hay 2 muertes adicionales. Esto eleva el número total de los muertes a 7 en el condado de Los Ángeles. Para las familias y amigos que han perdido a sus queridos, sepan que nuestros pensamientos y oraciones están con ustedes. Nuestra comunidad del condado de Los Ángeles siente mucho su pérdida y su pena. Hoy estamos reportando 128 nuevos casos. El número total de casos en el condado de Los Ángeles ahora es 536. 90 casos han sido en algún momento hospitalizados. Todos los casos confirmados están siendo aislados y a los contactos cercanos están en cuarentena. Hasta el 22 de marzo, alrededor de 4,700 personas habían sido evaluados en el condado de Los Ángeles y 10% dieron positivos. Todavía tenemos limitaciones en las pruebas y lo que significa esto es que es más importante ahora que más que nunca que todos cumplan a los requisitos del distanciamiento social. Gracias a todo lo que han sido diligentes. Y a un recordatorio al resto. No es apropiado que las personas estén juntados en los parques, las playas, muelles y en los senderos. Necesitamos su ayuda. El distanciamiento social no es un a veces sí y a veces no. Para que esto sea exitoso, todos necesitamos practicar el distanciamiento social todo el tiempo, especialmente cuando estamos en espacios públicos. Muchas gracias.
¿Sí, alguna pregunta en este momento en español?
There are no questions coming from the lines.
All right, let me make a couple of quick announcements. First, as of this morning, we've changed our posture again with respect to ICE transfers. According to SB 54, we're now adopting the standard which is going to be for serious and violent felonies only that will qualify for transfer to the custody of ICE, and this is according to SB 54, the California Values Act. And in closing, I think actually we had some technical difficulties at the beginning, so I'm going to repeat some of my remarks very briefly in case those who did not get it. And again, we want to thank everyone who is doing the hard work, those that are first responders, our public health people that are working at the hospitals and the clinics on the front lines. You're doing a lot of hard work, and we're here to support you. To our police and fire throughout the county, God bless what you guys are doing. It's a tough job, and we're there with you to support you all the way. This morning, we delivered 250,000 or 250,000 N95 masks to our hospital distribution hub in Long Beach. And we also delivered another 125,000 to LAPD, and we have about 30,000 has been delivered to the small municipal police departments throughout the county. So we're sharing our supplies, and we're dividing it between public health and first responders, which is an appropriate division. And I know public health and fire, they also have their own supply lines, and they're delivering. So apparently ours were a little bit more effective in delivering it first on. So later on, hopefully they'll return the favor to us, but the idea is we want to have everyone properly protected. That is our goal. And because of the size of this now, and our County Emergency Operations Center is at level 1, and as a director of emergency operations for the county now, we're locating all of our assets, the decision-making, the planning, the communication, everything is going to be located at the Emergency Operations Center in East LA. And this is according to the National Incident Management System, the NIM system, which is a structure and a framework how all large-scale, small-scale emergencies are properly planned for when you can, obviously, and the response, the coordination between all the different entities at the federal level, at the state level, at the local level. As a regional coordinator for mutual aid, all of the requests for resources, for supplies go through the Emergency Operations Center. And those that we can fill, the supplies we have on hand, we provide them. Those we can't fill, we refer to the state, to the California Office of Emergency Services, and they provide resources. They'll do the request statewide. And this is how the state and the county and the regional area, we divide the assets and the resources to make sure everyone has a proper amount of personnel and the supplies necessary to carry out the missions identified at the local level. All the missions are identified locally, and we're not using the National Guard this time in Los Angeles County. If the need arises, it'll be strictly for humanitarian purposes, and I'll make that request through the state, through the Cal OES. And we're not planning on doing that at this time. So we have sufficient resources on hand. And this structure, again, it requires cooperation. It requires a collaboration of everything, of everybody. So we also, with the activation of the Emergency Operations Center, the Joint Information Center, also known as the JIC, was also staffed and co-located on site. They are responsible for providing information to the media and the public on a regular basis until the crisis is over. By doing so, we have all the county's key stakeholders at the same location to enable quick problem solving and decision making. And like I said before, this is a storm, but it's a storm like we've never seen before. It's going to have a beginning, it's going to have an end, thankfully, and the sun will come out, we'll be back to normal. So what we need to do is everybody work together, and we'll make this a very short storm. So thank you. And this concludes our press conference.
Thank you, ladies and gentlemen. You now may disconnect.